Hi, my name is Martavia Richardson, and I will be doing a video on my research proposal. So, the topic of my research proposal was the effects of physical activity on mental health in middle-aged adults, right? So, let's start with the introduction. So, the introduction is mental health issues arise in midlife years. Exercise being explored as a non-medication approach. This research focuses on the impact of anxiety and depression, right? So with that being said, throughout your midlife years, there's a lot of things that change. This is your career. For some people, they're currently coming out of college. For some people, they're just now getting their first apartment, their first job, structuring their adult life, right, for the next 10 years or 5 years or however long, right? So, with that being said, a lot of issues would start to arise. This could be anxiety with even being in a new location, or anxiety or just being comfortable with their adult body. So, let's talk about some things that we will be doing for the participants in regards to pre-screening. Pre-screening. How will these participants qualify for the study, right? So pre-screening participants will complete a GAD-7 and a PHQ-9 questionnaires to assess like baseline levels of anxiety and depression. They will also fill out a physical activity questionnaire to determine their current activity levels. And then we have random assignment, right? Participants will be randomly assigned to either the experimental group or the control group. The experimental group will be instructed to engage in a moderate intensity physical activity for 30 minutes, 3 times a week, for a period of 12 weeks. The activities will include walking, jogging, swimming, or cycling. The control group will be asked to maintain their usual daily activities without any structured exercise. Then we're going to do a follow-up assessment. What the follow-up assessment is after the 12-week period, participants will retake the GAD-7 and the PHQ-9 skills to access to see if their anxiety or depression levels have changed. Compliance with physical activity guidelines will be assessed through the physical activity log, applicable, and then we have heart rate monitors. This is optional. The heart rate monitors, the study will be used as a between subjects design with two conditions, a physical group, an experimental, and a control group. The independent variable will be participation in regular physical activity, yes or no. So do you exercise on a daily, yes or no? While the dependent variable will be changes in anxiety and depression symptoms as measured and mentioned before by the GAD-7 and the PHQ-9. So, what is the target we're trying to get at? What is the research question and a hypothesis, right? Does physical activity reduce anxiety and depression in middle-aged adults? The hypothesis is adults participating in a structured exercise will show a decrease in these symptoms, anxiety and depression. All right. So let's talk about the literature review, right? So the literature review, I mostly got the bulk of my information from these two resources. They are very reliable, and they do talk about some theories that I will address in a few. So, right, we know the relationship between physical activity and mental health has been widely studied, with a growing body of research indicating that regular physical activity can be an effective treatment for both anxiety and depression. In middle-aged adults, these conditions are particularly prevalent, often influenced by, many lifestyles, biological factors, including stress, hormone changes, and even chronic health issues. Therefore, understanding how physical activity may alleviate symptoms of anxiety, pain, and depression in this, society can provide a significant benefit for mental health interventions. Also, some individuals, they're not comfortable with talking to complete strangers. They're not comfortable coming out of pocket, or they can't afford it. So what are some alternative strategies, or techniques that an individual can engage in to alleviate these symptoms of anxiety, depression? The gym. Working out doesn't have to be the gym. We could run a block and you could feel, a whole lot better. So let's talk about some physical activity and disorders that may, like, have some effect, right? So consider physical, emotional, and social dimensions. Exercise increases serotonin and endorphins linked to mood regulations. Excuse me. So when you exercise, there's a certain chemical that is released from your brain that is, it's something similar to dopamine, right? But it definitely makes you a little bit more happy. Okay. Excuse me. Hmm. Then we have behavioral theories. Like I stated before, there are some theories that align with this hypothesis. So behavioral activation. So routine behaviors can reduce symptoms of depression. So the more you are in a consistent flow of your exercise, the better outcome you receive, or results you will receive. Exercise promotes consistency and emotional benefits. Right? Then we have experimental with exercise and control groups. Sample, do we have design? This is just the design, how it will be, broken down. So we will have the experimental group that will be, we will just monitor how they would exercise, regularly. Then we will have a control group that will have a structural plan with throughout that 12-week period that we will closely monitor. The sample would be 100 adults age 45 to 65 from clinics or communities such as Planet Fitness, LA Fitness, any other gym. Then we have the measurement and process. As I stated before, the main two things that we will be using to scale or monitor um, these levels of anxiety and depression, it would be the GAD-7 scale to monitor anxiety. Then we have to monitor depression, we're going to use the PHQ-9 scale, the 12-week structured activity program for an exercise group. Then we have the control group continues typically, they'll continue their typical like daily routine. Like I stated before, we're not going to make them go and say, hey, you need to go out and, at least exercise 3 times this week. We just want to see if they go out, exercise once a week compared to um, you know, our structured experimental group that is out there that is exercising at least 3 times a week. And we're monitoring their intensity, we're monitoring their frequency, we're monitoring just basically their duration. So these are some hypothetical findings. So exercise groups are notable decreases in symptoms. The control group have minimal to no improvement. So as we know, we always hear this even when we was kids, the more practice, the better you get. This goes with anything in life, right? The more assertive and the more you apply yourself, the best results you will receive. So we're going to talk about some sample data summary, right? So the PHQ-9 score dropped by about 5 points. The exercise group, the GAD-7 score dropped by 4 points, and the control group changed by 1 point. What does that mean? So what does those scores mean, right? Interpretation. Exercise groups benefit supports the hypothesis, right? Then we got results align with the past studies. So my results or study do align with the previous studies conducted by researchers before me. Then we have activity may improve mood in middle-aged adults. So future research, what would I do differently for my future research? So for my future research, I would examine long-term and mental health outcomes. I would include diverse participants and backgrounds, right? So this will have a variety of all cultures within my study. Study from different all study different activity types and duration. So what type of exercise that each individual is doing and how long they are doing this for. I will also monitor the intensity, how hard the the individual is doing or applying themselves. So we're going to go to our conclusion, right? In conclusion, exercise is a promising tool to support mental health. Accessible, is low cost for anxiety and depression, and it supports a holistic and a premeditative, it it supports holistic and basically prevents you from like doing anything that what gets you in trouble, right? So all that built up stress and you refuse to go to, therapy or take the medication, it kind of, acts like a buffer for you. In regards to references, these are my top two references that I use throughout this um, research proposal. There is other resources that I did include that I will attach in the speaker notes if needed. With that being said, thank you. And it was great to kind of tell you guys about my research proposal study. And I hope you guys enjoy it.